living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
Healthcare in America is rapidly changing, and when it comes to improving the quality of patient care, Patient and Family Advisory Councils, or PFACs, are helping healthcare systems improve processes with the patient in mind. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm your host, Lisa Sather. Stay tuned to learn all about PFACs in this week's show. Welcome back to Healthy Living for Life. Joining us now is Rhonda Heinrichs, who administers the Patient and Family Advisory Council, or PFAC, at St. Peter's Health. Rhonda is here to talk about PFACs. Rhonda, thanks for joining us.
You're welcome.
Yes, so let's just start out right out of the gate. Tell us what a PFAC is.
So Patient Family Advisory Council is what it stands for. And our PFAC council came about from our CPC Plus, which I'm not sure if you know what that means, but it's basically team-based care.
Okay.
And team-based care takes a holistic approach to how we care for patients, and there's a team of people that surround this patient and take care of them. Okay. Part of that is if you're a part of the CPC Plus, now kind of leading into team-based care, they ask that you have a PFAC committee and a community council. Okay. So that's kind of how it started. My committee that I am on now and that I chair started probably a year and a half ago, maybe a little bit. It probably has been 2 years now. Oh, wow. Anyhow, we started with a group of people that were on a community-wide board that kind of disbanded, and then that's how I kind of got my peeps. Okay, awesome. Yeah. So it has patients and family members, and they serve as advisors, I guess. Correct. And so what exactly are they advising on? Oh, a lot of operational things. You know, what are we doing well? What can we work on? And they just kind of come up with ideas, and then we work on them. One of the projects that we worked on was a packet for new patients. You know, getting to know your new provider, for instance. So the one that we're starting with is Emily Hedham. She's one of our new providers, and she was brave enough to be the first person. So we are just getting going on that. It takes a little bit to get the packet together. And what the packet does is it says, you know, some fun things about her, a little bit personal, sends a picture. We send a magnet with the patients, and it kind of tells them where to go for what. Helps you navigate the system a little bit. Cool. So how many people serve on St. Pete's PFAC committee, and is that, you know, a typical size? What's a typical PFAC size? We probably have 15 members, I think. Oh, wow. About half are community members and half are employees. Okay. And we picked our employees a little bit from everywhere in primary care. And as I said before, we have this team of people that take care of a patient in primary care. So we got one of every type of the team members. We have nursing staff on there, we have a pharmacist, we have a care manager, we have a social worker, and 2 providers. Awesome. And then myself. And is that a typical size for a PFAC committee? Does that seem about right? I think you try to keep your committees, you know, maybe under 12. We're a little bit bigger, but it's kind of grown. But it works. It works well. People are very respectful, and it's not any one person's agenda, so it works for us. So how does the hospital go about recruiting members for the PFAC committee? Well, like I said, for ours, we kind of absorbed another committee. Okay. Mm-hmm. We're actually looking for at least 1 new member. So what I've done in the past is I've gone out to either our physicians or our advanced practice providers and asked them, do you have somebody, you know, in your panel of patients that might enjoy being a part of this and could commit to it? So great. So how much time do the members have to dedicate to PFAC efforts? Well, it's truly an advisory council, so the amount of time commitment can be as much or as little as you want. We have people that one of our agenda items was looking at wayfinding, and when I say wayfinding, I have to explain that because this particular person, he wasn't sure what that meant, as a lot of people weren't. Basically, how to get around in our clinic. And so they took on this and looked at some of our signage and stuff and realized that maybe some of this wasn't great. So we've made a few changes that way. We haven't made all the changes that we kind of talked about because we're not sure on our master facility plan who's going to be where, and we don't want to waste a lot of money. But we've made some good adjustments.
Wonderful. So once a person becomes a PFAC member, is that a lifelong position or
lifetime
term
sentence?
limits? Yeah.
There are term limits.
Okay.
We have half that are a year, and then the other half are 2 years for the community members. The staff members, we kind of just trade off. People take turns. You know, we've had 2 pharmacists, they kind of take turns, or our care managers. So.
Excellent.
Yeah.
So do they receive some type of special training to be able to, know how to participate and what to do as a team member?
No, their only training is to have been a patient or a family member of a patient and experienced our healthcare system and know a little bit about it, the ins and outs, and maybe what needs improvement.
So that's a good point. And I guess leading into that, can you talk about how you address patient confidentiality with these folks? Because they may have been a patient themselves or a family member of a patient, just in terms of confidentiality and making sure that that's, kept in mind.
We actually have not come up with anything that would breach any confidentiality or privacy issues.
Okay.
We don't probably dig that far in, and if they want to share a story, that's up to them to share it, but really we don't have anything we've never had an issue with that.
Perfect. And maybe time for one last question before our break.
Okay.
Any special projects you're working on right now that you could share with us, just high level?
High level, we're looking at a new phone system.
Oh, excellent.
So that will be awesome. The phone system that we currently have doesn't allow us to get the data from it that we need to know, so we know, when our high call volume times and that kind of thing. So we've brought all that information to this team to kind of share with them. Another thing, let's see, that we're working on, maybe someday we'll get to a point where we can do online registration or online scheduling.
Excellent.
We're dabbling just a little bit, trying to see what our electronic medical record will be capable of.
Perfect. Thank you. We're going to pause for a quick break. So we'll continue our discussion with Rhonda about PFACs after these messages. Stay with us.